Good morning, everyone out there in the Move Well community, Move Well University. Wanted to talk about something I was thinking about this morning as I'm working out here. And I was thinking about this. I was thinking about some of the doctors I talk to, or some of the comments that I see periodically, or some of the debate within the chiropractic profession is, stay in your lane, or this isn't something that we should be handling. We should let physical therapists handle functional anatomy and functional movements and all this sort of thing. And so I want to think of an example that we all see every single day that literally, if you're not addressing, you will never fix your low back patients. So who here as a chiropractor sees low back pain patients, low back problems? Everyone. It's the number one reason people come see us, right? Whether you want to admit it or not, whether you want to be more of a vitalistic provider, more of a musculoskeletal provider, whatever. The fact is, the public thinks of low back pain, I'm going to go see a chiropractor. That's typically the number one reason people come see us, okay? So how do you take care of these low back pain patients? And a couple of patterns that I want to talk about that are very common with people with low back pain. And now this is not all of them. There's a lot of different variations, but I'm going to give one very, very common example and how if you are not addressing the segmental component, which is what most of us are doing as chiropractors, the postural component and the movement component, the functional anatomy movement component, if we're not handling or addressing these three things, we're never gonna fix these people. So this is what I'm gonna do. I'm gonna flip this camera around so I can draw on here on the board, because Facebook on the phone likes to have everything flip-flopped. So, flip. All right, now you can see it regular. All right, and I'll stand over here to the side. So it says, Chiropractic FM with Move Well U. Question, do I really need to know this stuff? My answer is, well, it depends on what you want to do for your patient. So let me just show you a common, I'll just draw it out, okay? So common is, that's the side view, right? And a common thing that we'll see in patients that have low back issues, not all of them, I know there's a lot of variations, but a common one is this will tip backwards, they will lose the lumbar curve, they'll have a huge posterior thoracic shift, and basically what happens is they have an increased thoracic kyphosis, a decreased sacral base angle, or decreased pelvic tilt, so they, like this, they shift backwards, okay? And the head will come forward, so the head will protrude forward. This is a full spine sagittal issue. It is something that comes from sitting lots, it comes from having lack of good abdominal control. It has a huge thing to do with what I'm going to talk about here is posterior chain weakness, which is all the muscles in the back part of the body. They might be tight, but they're tight only because they're being pulled tight like a string, trying to hold the body into the sling that's really just hanging on the joints. And the posterior chain needs to be activated in conjunction with, of course, fixing the segmental problem, so adjusting the spine specifically, getting irritation off of the nerve, correcting or helping improve the mechanics of the joint and the disc, step one. However, if the segment is the only thing that you're addressing and their posture is still like this all day long, now you have all of this leverage of their overall body weight forcing them back into an abnormal position, puts more strain on that joint, and the joint is going to subluxate again. It's going to be dysfunctional again. How long do you think the segmental adjustment is going to last? The answer is, in these cases, not very long. You might get them out of pain pretty quickly, but long term, you follow these people, their spine's going to degenerate, it's going to break down, and they're going to have reoccurring issues almost at the same frequency probably as if they never came to see you to begin with, because you're not really fixing the cause of the problem. The cause of the problem here is their entire machine is shot. Now, here's why if you address the segmental component, so you adjust them, you then do things to pull them forward, so you try to work with posture, things like maybe traction, spine remodeling traction, forcing them forward, maybe doing a postural corrective exercise where you have them shift in the opposite direction, All good things, but there's still something that's missing. And the thing that's missing here is what's very common, which is interesting, in the exact opposite posture too, where the pelvis is tilted forward, okay? And a lot of these patients, what you'll see is that they have tightness in their hip flexors, okay? They have weakness in their glutes and posterior chain, overactivity in the piriformis, so pain in the pelvis, and all of these things cause a inhibition or breakdown in posterior chain, makes it almost impossible for them to get the posterior chain active. I'm gonna explain this step by step, so I know I'm throwing a lot of stuff out there. I'm gonna explain it step by step because I want you to understand this thought process, because this thought process applies to more than just the lumbopelvic complex. It applies to stuff going in cervical thoracic spine, lumbosacral spine, down the foot and ankle, neck and shoulder. I mean, so there's 5-6 patterns like this throughout the body, but this is one of the biggest major ones that you gotta understand, you gotta own as a chiropractor. And so a side note, if you're saying, well, let the physical therapist handle it, let the personal trainers handle it, they're not, because nothing against physical therapists, but they're a little bit handcuffed in the sense that they are referred a patient by a medical doctor. Medical doctor puts the diagnosis down. Hey, the person's got a shoulder problem, work on the shoulder for 6 weeks. Person comes in with a shoulder problem, they have a problem with posterior chain, all of this, movement disorder. They're not addressing that. They're working on the shoulder because that's what referring medical doctor told them to. And if they want to be a cowboy and work outside of that, either A, they run the risk of not being reimbursed on their insurance. B, they run the risk of not getting referrals from that doctor anymore. C, it's just not what they do. They're not taught to do that. It's not standard to do that. Rarely you'll have physical therapists who do that, who understand all the functional movement stuff and get to apply it. That's the difference. So as chiropractors, let's take advantage of our license that we actually can diagnose. We can take x-ray, look at x-ray, we can understand this stuff, and we can manage this from a holistic but bird's eye view of not just looking at one little thing and then allowing that patient to really leave your office without a complete fix. So here's this process. Let me just make sure we're good on camera, and okay, we're looking good. Okay, so here's how this works. So a common thing is hip flexors. Hip flexors will be tight, overactive. Okay? So hip flexors, tight, overactive. So those are the muscles in the front. So that is going to cause a chain reaction. It's gonna address the other side of the body, which is the back part of the body, which is going to cause reciprocal inhibition of glutes, which is probably the most important main primary posterior chain musculature. Kind of sets up the whole thing for either being functional or dysfunctional. So now glutes are inhibited because the hip flexors are tight. Well, why are the hip flexors tight? Well, people are in a hip flexed position. Okay, they're seated for long periods of time. They're not using the opposing muscles, so sometimes these muscles in the front from being in this position of adaptively shortening and then becoming tight because they're in a shortened position most of the time. You'll just see this pattern with a lot of patients. Hip flexors, tight, overactive, okay? Reciprocal inhibition of the glutes. Now, you can't just stretch hip flexors and give them some stretches and call it a day, all right? And here's why. So hip flexors are tight, reciprocal inhibition of glutes. You can't just give them glute activation exercises and call it a day without addressing this, because they'll never activate, because neurologically they're shut off because the opposing muscle is tight. So it makes it hard for them to activate the glutes, okay? So are you following so far? So then what happens, there's a third thing, reciprocal inhibition of glutes. So now you have overactive synergists, okay? I'm supposed to be able to spell it too. Synergists. All right, overactive synergists, and these are going to be the hip rotators, things like, you've heard of this one before, piriformis, okay? Now this person comes in and they have low back pain, they have sciatica, and they were diagnosed by the referring provider or whoever, you have piriformis syndrome. We should just work on stretching the piriformis muscle. Well, they're missing a couple of things here. The piriformis is an innocent bystander that's trying to cause hip extension and external rotation of the hip because the main extensor, the glute, is not working. and the glutes not firing or working because the hip flexors are overactive, short, tight, and they're reciprocally inhibiting the glutes. So you can see how this chain reaction happens, right? Now, the inhibition of the glutes and the entire weakness of the posterior chain, which oftentimes these things come in bundles, now the posture is in this weakened position. And then that snowballs, this gets stronger, 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 and before you know it, this is just how someone's been for a decade. And you're not gonna fix it by smashing piriformis and stretching or activating glutes without first going through a special order, a special sequence. This is stuff that we talk about, we teach inside Movable University. And real quick, if you haven't already, grab our book, which, let me grab a copy for you, I'll show you. Which is called Move Well Secrets. It's a quick read, it's 18 chapters. We go through, we talk about this in a bird's eye view of how this all works. And you can get it for free. You just go to moveWellUniversity.com/book. We'll send you out the book, you just cover shipping. But here's the deal, is that we in Movable University, we teach how to go through a movement assessment in 3 different levels of complexity. So you can start really basic, and then when you master that, you can go a little deeper, and then go even deeper to really dig deep, differentially diagnose this stuff, geek out on it like we all like to do as chiropractors, as clinicians. Then know exactly what protocols to prescribe based on that, but have all the systems in place so it's seamless, it's easy. You have forms that you just check things off on. You can teach your staff to help you with this process, depending on what state you're in and how different laws and stuff work, whether you have to do it yourself or you can have staff assist or whatever. You can create an entire department in your clinic where you're just prescribing this, sending the patient off knowing that they're getting the best quality, evidence-based, researched methods of correction, handling the stuff. Patients love it. There's ways of engaging the patient. There's ways of giving them resources they can take home with them. It's not just a piece of paper with an exercise scribbled, but it's a lot more high tech. I mean, it's 2019 right now, so we got to be with the times. And so anyway, and then how it fits into a chiropractic model. So this is an example of if you're treating low back pain patients and you don't understand this whole sequence, you're never really going to be able to get them stable and fixed. So I hope that's helpful. I just finished up a workout here in the morning. I gotta get ready and go in and see patients in the clinic. I'm looking at the clock. I have 16 minutes to get on, so I'm gonna get off here. If you have any questions or comments, leave them below. If you found this helpful, share this with some fellow chiropractors. If you're in a practice where you don't call the shots, but you're like, man, I really wanna be able to implement this stuff, go to our website, moveWellUniversity.com. There's lots of resources on there. You can show that to the other people in the practice so they can see what this is all about. And they can see that it's not really like, it's not a therapy. It's not an adjunct. It's not a modality. It's not the newest, coolest laser to put on the feet for neuropathy. This is like clinically how you should be looking at things forever. And this really gives you a whole different level of satisfaction in practice, knowing that you're really addressing the true cause of the problem with your patients. You're talking about stuff that they understand and that they want to know about anyway, which is movement and exercise, and it's fun. It's really, I'm 16 years into practice now, and this has been a much more fun way to practice clinically, systems-wise, than ever before. And so I know I could never go back practicing how I did before we refine these systems and put them in practice. And I know all the doctors that we currently work with, that we're helping them do this in their practice, they say the same thing. They're like, I'm having so much more fun, patients love this, it's like a whole new practice. And it's really cool because this is stuff that we should know anyway. We never really learned it like this. And so we did all the heavy lifting for you. We spent the last really 3 years refining and putting this together. And now we have this in a very systematic, step-by-step program. So anyway, get the book, moveWellUniversity.com/book if you haven't already, and reach out to us. You can always send me a message on Facebook if you have any questions, or you can find us through our website, moveWellUniversity.com. So appreciate you. Have a great week in practice. We'll talk soon.